That's awful. What you doing, honey?
I'm not sure. Did you hit record? It didn't count down on my end.
Well, because you went off.
I didn't go off.
It did. It made your whole face go away, and it went with an A.
Oh, I didn't see countdown and I didn't go anywhere. But anyways, what's up? What the vet fam? Tell Joyce to get off my back today. Tell her to get off my back. Anywho, playing my nerves like a fucking banjo right now. Anyway, so right back at you, babe. But we are talking. First of all, I hope you guys had a wonderful week. Okay. So I hope that you don't have friends that banter you and bully you like Joyce does me on a constant basis. She's contributing to my mental instability.
Just okay. It's just one-sided. Yeah. Okay.
So, anyway, we are here today to talk about emergency medicine and whether or not, if you're a pet owner, whether or not you should have a pet if you can't afford emergency care. I have thoughts on that. Joyce, I'm sure
I
you
have
do
thoughts on
too.
that as well. I've heard people in the veterinary world, because I started out in emergency and critical care, say that exact thing, right? If you can't afford this, you shouldn't have a pet. And I've never agreed to it. Generally, every place that I worked at allowed you to have a balance if something were to happen to your pet within reason,
Hmm.
because again, emergencies happen and we never had to pay out of pocket. So to the people that say that, and I mean, mind you, I've been gone for a couple of years, but I don't think the system's changed drastically in that regard too much. I know there's certain criteria, and we'll get into that. But if Allie dog needed surgery right now or emergency care, I can't do it. If
Yeah.
Red needs a surgery, that's $10,000 for a horse. Just walking into an equine hospital.
Yeah.
10 grand. I don't have that. And my credit score definitely tells me I can't afford that. Do I still have a horse? Absolutely. Am I very cognizant of the fact that my bank account is less than what it was? If an emergency were to happen, I would have to make very, very hard decisions. And I had to do that with Rascals when he had cancer. I do let age play a part in that because he was elderly, he was geriatric, but he had a tumor. I didn't have it taken off. I did not, because I knew long term I wasn't going to treat it, because besides the point, but also financially, I couldn't do it, and so I chose to treat with the medicines that I had on hand. And then when it was time, I euthanized. But again, I had to base all of my decisions around me being financially strapped. So no, I don't believe in that statement. I hope I have never come across to the clients as I'm giving an estimate, as they're wondering if they could ever afford it. I hope I didn't come across like, oh, well, you shouldn't have this pet. I hope that never came across, because I'm an advocate that a pet brings a lot of joy into people's lives. And, you know, this can go even deeper to how homeless people have dogs. And I know this isn't a rabbit hole you necessarily wanted to go on, but
I'm down.
okay, hold on. Allie's going to get stuck. Come on. There you go. Allie wants to weigh in on this conversation. Okay, okay. You can't have that. You can't have that. Please stop. If you look at a truly homeless person that has a pet, how often do they look like Raggedy Ann?
They don't.
Never. They don't. You want to know why? Because every time that man gets a hamburger, that dog gets 3/4 of it.
Yep. They eat before they do.
That dog gets 3/4 of it. They do everything that they can to find help. And how many times at a shelter, Amber, have you
Yep.
seen that a homeless person came crying in and said, something's wrong with my dog, I can't afford it, please help it? And he has to walk away from that dog, right? Mind you, a lot of the times people are homeless for a variety of different reasons. But I will volunteer all my free time to help clinics that go out and help homeless people and their pets.
Yeah. Absolutely.
Because
Absolutely.
there's times where they take better care of their pet. Mind you, they're living in tents or in a box. I don't care, but that dog has more blankets than they do.
Yep. Yeah.
That
I've seen
dog
it.
is more loved than some of the people that I've seen had pets.
Yeah. Yep. Our animal services officers
Okay.
used to carry food and water bowls and treats
Yep.
and all kind of stuff, even toys in the cars, and they would go by the homeless camps and they would give them, what they needed. And a lot of times they're like,
And
you
it
know
and
what?
it makes them 10 times
Yeah.
happier.
Yeah.
I know, and I'm going down a rabbit hole. This wasn't like the main point of it, but like I saw a homeless person, and do they use it to help get money and things like that? Yes. But they also use it for different reasons for the
Yeah.
people that are truly homeless that can't function in normal society, but they can function as someone that will love an animal and
Oh,
take care of them to
absolutely.
the best of their abilities.
I
Now, here is the catch 22 of when I start judging people, right? When it comes to I can't afford that. When you come in and you tell me how you bought a brand new luxury car, knowing that your dog had a chronic illness, and you can't afford your luxury car, let alone when you go beyond your means.
hmm
When you go purposely beyond your means because you're keeping up with the Joneses, and I'm not saying this is for everybody, this is what I have personally seen in specialty medicine with chronically ill pets. And I can't afford this. You can take your car and get it downgraded and have a lower payment. I've done that. Technically, I need a new car right now. Am I going to get it? Absolutely not, because this payment is what I can afford with my horse and my dog.
yeah, because those are responsibilities that you took
I
on, and that you are cognizant that you are responsible for them.
So that's the only time that I have a hard time when I hear pet owners come in and say, I just bought a new Cadillac SUV. You can look up those price tags and how much that is a month. And then you did that knowing your dog that you love within to the best of your ability has these issues.
Yeah. Well, too, I mean, you see it not just in like emergency things like that, but you see that in general practice, to where they'll go spend $3,500 on a dog at a puppy store or Craigslist. Craigslist ones come in and they're blowout positive for parvo, and they spent every last dime they had on that puppy but can't afford to treat it for parvo, right? Or you go outside of that, they can't afford to vaccinate it, they can't afford to start it on heartworm prevention,
Yeah.
let alone an emergency bill.
So like this is a gray area of conversation. It's hard, like it's just for the people that are saying it in vet med, we have the luxury to have a bill and pay a certain amount every paycheck, every month, every this, every that.
Yeah,
They I've yet to I personally, and maybe you have, that they make you pay it within 2 months. Let's just say two
yeah,
months. I've never seen it. I've set up, I had to pay to have my dogs come to work with me every day as like a boarding charge at the place that shall not be named. And that got taken out of my paycheck every 2 weeks. And, blood work and blah, 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 blah was put on there too. And that, I just had a set amount that came out of my paycheck every 2 weeks. That's as far as it would go. And obviously, when you left, if you didn't pay your bill, your paycheck went into the bill and so on and so forth. We saw it that way. But we never had to come up with a $3,000 payment.
no, not up front.
We as in veterinary technicians.
Yeah,
I've never I've never personally heard a tech except in equine world because that is so much more expensive. I've heard like their horse went to surgery and they had to put a deposit down and then it went on their bill on their account.
yeah,
That's as close as I've personally heard. And so I take that as a luxury in veterinary medicine.
yeah, yeah. We have that luxury.
We're we I had that luxury personally on my dogs when they needed things, when they needed a procedure done. Yeah, I don't care, do it because we're not paying up front.
hmm
Like a guy coming in at Christmas time with his 3 kids and his dog lateral, and he sees a $5,000 deposit for HGE. I'm not going to judge that man. It is Christmas time. I know damn well the amount of money that you've been spending
Yeah,
with 3 kids, and you're seeing how am I going to come up with this money? It's not my fault his dog got sick during Christmas time. It's not his fault his dog got sick in that instance. And so I will look at them and I go, okay, what can you afford? And we're going to see what we can do to work around it. Is it the gold standard? Absolutely. Right now we're looking at a gray standard, but it might be enough to help save your dog.
yeah,
Let's see what we can do for that. And that's the way I would bring it to the table. I've seen other people say absolutely not. They don't deserve that dog. But I've also seen it on the client side where we are the spawns of Satan because it happened during a holiday and they were taking Christmas away from them. Don't get me started on that rant.
yeah. Don't go
I'm
down
gonna
that. Yeah,
settle on that one. But
I will turn
I've
all
seen on
kinds
the
of
flip
colors.
side, but but I will never judge a person if they can't afford emergency funds,
No.
especially now.
Yeah. Yeah.
And the vet tech should not be judging.
No.
We aren't paid enough to have an emergency fund. We are not paid enough to have an emergency fund 9 times out of 10 if our pet is injured in another state. Because guess what? Do you know how many times I've been in a different state at a different hospital with people that I actually knew and worked with in the past ask me if I got a discount for being a vet tech? Not once.
Yeah. No.
Not fucking once.
No.
Did I ask for it? No, because I feel, and have I personally given a technician a discount when they said that they either were a tech in the past or were a tech from another clinic. I personally put a discount on their
Oh
bill.
yeah. Absolutely. Absolutely.
Not once has that happened with me in other states at places that I've been to that I personally know when they open up their own practice. No, they didn't do that, nor did I expect it. It would have been nice. But, it's not a common
No.
courtesy.
No. It's not. And for a veterinary technician in an ER to drop that sentence, they shouldn't have this pet if they can't afford an emergency. I've looked at one before and said, if you couldn't
Neither
rack
can you.
if you couldn't rack up a bill here, could you? Could you afford
Mm-mm.
$1,500 just for what we did for that one? Could you? So
Nope.
don't
Nope.
stand here and judge a client because they can't afford an emergency bill. And let's talk about this, right? So you have a client who has a pet who can't afford an emergency bill. How many human beings go to the ER and they can't afford their bill?
I didn't pay my when I had to go to the emergency clinic. My bill for fluids, an injection of Motrin, IV injection,
Hmm.
something lanced was 1,500. I didn't pay it.
Yeah. I mean, how many? And two, you take your
I was
kids.
there for 2 hours.
If you
Yeah,
have a child, and again, people are going to come at me for referring, to comparing children and animals, but for a lot of us, it's the same thing, right? If you have should you not have a
yeah,
child if you can't afford to take them to the ER? Why is it, you know what I mean?
yeah.
So,
I heard someone last night at a party say, "Well, you can never really afford a kid, so just have one."
yeah, yeah,
Like that's the mind frame of people. And I was like, no, I'm not choosing between, because it was like, conversation of the expenses of horses and kids. And
yeah,
I was like, and I was like, no, because I'm not going to have to choose between one or the other.
yeah.
Right. But like we have a luxury to where we can rack up a bill.
We do. The whole if you can't afford an emergency, you can't afford a pet thing, I don't agree with. But what I do agree with is if you can't afford the basic necessities, your preventative care, your vaccines,
Mhm.
a good quality diet, shelter, like things like that, then you should not have a pet. You shouldn't. That's my that's
Yeah.
my my thing right there because preventative care and things like that, that's absolutely important. And if you can't do that
Yeah.
for them, you
I
shouldn't.
mean, Allie's on prescription diet,
Yeah,
which is $60 for six
I was about to
pounds.
say for a 6 pound bag. If you
Yeah.
can't
You
afford
know,
a,
and I don't question it. I go, okay, that is allotted for this
yeah,
amount, and off it goes. And Allie gets her meds and that,
hmm,
or her prescription dog food because she's proven that she can't come off of it, and so she's will be on it for the rest of her life.
yep. And two, like you shouldn't be if you do have pets and you can't afford to go to a fancy GP or something like that. Even if you go to a Walgreens
There's
shop
other.
clinic and you get those vaccines done
Mhm.
and that heartworm prevention, that's still you taking steps to take care of your dog. Just because you
Yeah,
cannot
like
afford emergency care, a $10,000 bill, 5,000, even a
yeah.
$2,000 bill, does not make you any less of a person or a horrible pet owner. It doesn't.
No, it does not. And I never want people to think that
No.
they can't, because like animals do bring so much
Yeah.
to people when they need it the most. That's why we have pets.
Look at them. Look at them.
I would show you Alley Dog, but there's a hodgepodge of things going on my bed.
They're
But
snuggling
yeah.
with the cat.
Yeah, no, like I'm in that boat. If something happens to Allie, I'd call on a few people to borrow some money that they knew that
Yeah,
I would pay them back. But if that isn't the case, I'm up that creek without a paddle.
exactly. And even years ago, right, like pre-COVID, when the economy wasn't doing so bad, people still didn't have those funds. And now people
Hmm.
can barely afford to feed themselves, their children, keep gas in the car, keep their homes. Do you know how many people are homeless
Yeah.
right now, living in hotels or streets or other because they can't afford they can't afford anything right now. So to bash them or belittle or devalue them because they couldn't afford emergency care for their pet, it's not okay.
No,
Everybody's doing the best
no.
they can right. I can't say everybody's doing the best they can right now, but
Like we don't know everybody doing the best that they can,
exactly.
but generally, I mean, if a person is bringing their pet to a hospital and saying, "I only have X amount of money," they're already winning in my book because
Yes.
they're like, this is financially as far as I can go. Perfect. I
Yep.
know what we have to work with and what we can bring to the table too. You're going to walk out here with $0 in your account.
Yep. Yep. You're either
You
gonna.
know that, I know that,
Yep.
we know this.
You're
And
either.
you took that step to acknowledge to a stranger, this is all I have
Yep.
for my dog.
Yeah.
That alone is so hard for people.
Yep.
And you only do it for something that you love. So, no, I'm not going to judge you.
No. And you have to have that understanding that they're either walking out with $0 in their bank account or they're walking out of that emergency facility without their pet. And or both.
Yep. And or both. Yeah.
And or both.
Yep.
I've
And then we're going to use the parvo situation.
hmm
Yeah, you got this puppy. When I was a kid, I bought a Petland puppy and she got kennel cough. She was a $1,200 black lab from Petland
well
and
that's
it
cheap
brought her
back
home.
then.
I thought she was the best. She was the best little puppy ever. And 2 days later, she was diagnosed with kennel cough and was sick for 2 weeks. And we had to take her to the vet multiple times. And, like the only reason we could do it at the time is because I used inheritance money, but it was just me and my mom at the time.
Yeah.
And like luckily they covered some of the bill, but like, that strapped us with x-rays and everything like that. And thankfully that's all it was. It wasn't parvo, but that's how I got Allie Dog. She was a parvo puppy.
hmm
She was surrendered. And then I met her a couple of days after I euthanized my mastiff. They couldn't afford it. I couldn't afford a parvo puppy.
Yeah. It's a lot.
Like a truly sick parvo puppy with round the clock care. People think, oh, it's just parvo. It's not just parvo. Allie Dog got plasma
Yeah.
multiple times.
Yeah.
She got plasma. She got all kinds of stuff for a week and a half, round the clock care until she rounded a corner with IV fluids, the whole gambit of things.
Yep. And now we have monoclonal antibodies that can be used for parvo patients and things like that. They're
Mm-hmm.
substantially expensive. They work, but they're
Mm-hmm.
expensive. And who
Yeah.
has that?
So, you're lucky if your just parvo puppy just needed sub-Q fluids, antibiotics, and a couple of other things, and that's it. Allie Dog was going to get euthanized, and it was one technician that stood up for her. Tina, this goes out to you. I wouldn't have my dog without you. Because she said we save all these other ones, why not this one? Because
Yep.
I didn't meet Allie Dog. I didn't meet Allie Dog until she was allowed to come out of isolation. And I just heard her barking when she was better. But, the doctor was like, I think it's time we euthanize this puppy. And she was like, no, let's give it plasma. We do it for all the other ones. And she was like, well, and she was like, no, we do it for all the other ones. Why not this one? And
Yeah.
because of that, one technician stood up for her. I have that dog.
Yeah.
That no bad dog.
Yep. And sometimes that's all it takes is that one voice to be like, you know what? Why? Why can't we do
So
it?
when people say it's just parvo, it's not just parvo.
Yeah.
Like you were lucky if that's all you had to pay and do supportive care. I've been trapped in isolation. I couldn't tell you how many times on a 12-hour shift, just literally constantly taking care of all the sick puppies that were there. Because you can't get a break when you have more than two parvo puppies going in around in a circle in the little isolation ward.
Yeah. It's rough. And then when they don't make it, and you put everything you have into it, but that's a whole other rabbit hole. But people
Yes.
should just
You got
not.
me on a rant. You got me on a rant about parvo and money because I hate when people say that.
Yeah.
Like, oh, they're just when the vets are just taking you. No, they're not.
Nope.
Sorry.
No, but I mean, and again, because you can't afford it, if you make other choices, right? And like you said, your luxury car versus treating your pet, or your $1,200 purse and your pair of shoes versus treating your pet, then I have no respect for you because that's a life that you took responsibility for that relies on you, right? But if something
Yeah.
happens, if you're outside walking your dog and they get off the leash, because shit happens, that's happened to me today, and your dog gets hit by a car and you have to go to the emergency room, chances are you're not going to have the money to treat your pet. And that is not
Mm-mm.
anything that you should be shamed or belittled for. It's not.
No.
Now, I am like back in GP and I do push pet insurance to the hilt just because of what I've seen at the place that shall not be named and other places as well. However, on our side with insurance, you don't have copays. You have to pay the bill up front and then you might get
Yeah.
reimbursed. You might,
Yeah.
except for like Trupanion and Pumpkin, hate to name drop, right? Those guys are awesome because you can settle your bill in the clinic rather than having to submit
Right.
all of your claims and
And
whatnot.
then get reimbursed.
Exactly. So you can
Yeah.
do that in the clinic if your clinic participates, but all the other ones you have to submit and you have to wait to get your money back. But again, who has that money sitting around?
Yeah, there in the 16 years that I worked in specialty, right? So like I'm used to seeing and making those big estimates, right, on
Yeah.
emergency basis. And out of the 16 years of making estimates, going over life-changing things, there was only one person, one family that from the get-go did something that I've never seen anybody do. Yes, people have pet insurance, and it wasn't until the last 5 years that I feel like pet insurance has really stepped up their game
Uh-huh.
and has been actually worth the money. But they made a credit card or like a debit card for their dog when they got it, and they budgeted each paycheck went into this card, no one touched it, right? So for 6 years of this, it was a coonhound, and that dog was hysterical. I loved the owner; she was great. They had money, but at the time when they got the dog, they didn't have a lot of money,
Yeah.
and so they were like, "Well, if something happens, what can we do?" And they had that pre-thought, and it's an idea because like honestly after all of this it stayed with me, right,
Yeah.
where each portion of their paycheck went into this card. So when that dog came in with ITP just out of the blue, she was like, here. And it had at that time thousands and thousands of dollars on it, right? And they did everything. So but it got to a point where she said, it's tapped out. There's nothing left on this card. And now we only have X amount. And I went, okay, now we can figure out where we're at. But I mean, that dog went through, I couldn't even tell you how many blood transfusions
Yeah.
that dog went through, and a splenectomy
Oh wow.
and vincristine. Like it went through the gambit, right? Like, so like when I tell you that she spent over 10 grand on this dog in a course of a year to get him in remission on expensive medications because he's a coonhound, he's not skinny. He's
Yeah.
not small by any stretch of the imagination. And finally, it got to the point where she said, okay, we're tapped out. We can only do X, Y, and Z. And I'm like, cool. But she was the only person in the 16 years that did that. If that shows anybody that watches this that's not in vet med, thousands of people I have dealt with, only one person did that, right?
Right.
So that whole story, only one person did that without pet insurance. And even there's times where even I'm like, pet insurance is not worth the money unless you have X, Y, and Z dog.
Yeah.
And we can go on a whole list of that later because it wasn't until because of the fact that you still had to pay out of pocket and only get reimbursed X amount.
Hmm.
Except for now, they're now getting settled at the front. That's where my opinion started to change, is when they started to be able to do that, because again, your bill is $3,000. You have to still come up with $3,000 and then wait X amount of weeks for your check to come. It doesn't get direct deposited. It still comes in a physical check.
Hmm.
So the fact that there's now two pet insurances that are doing that makes me happy.
There.
Settling it in that whole ranty rant of something, but it just shows people that even if you take on a pet, I only had one person out of 1,000 put money off to the side.
That plan because they knew emergency.
I'm not doing that. I'm telling you that right now. I'm not doing that.
A lot
Right,
of
I
people
can't right
can't.
now. Every dollar goes to gas, food,
Yeah.
Olipop.
Exactly. But like again, just and it doesn't make you a bad pet parent if you can't afford an emergency.
Absolutely not.
It doesn't, because it doesn't
No.
make you a bad parent if you can't take yourself to the ER. Let's just put it to you that way, or afford, your copay for surgery or something like that. But what we have to keep in mind as veterinary professionals is when you have a patient brought into your ER by their clearly upset owner who may or may not have the funds to treat them, don't be a judgmental asshole. Put yourself in their shoes. If you did not work in that facility and
Mhm.
you brought your dog in there, could you afford that bill? Show some sympathy, show some empathy, work with them. So, what can you do? But they have to understand no matter how many thousands of dollars they put in that animal, they still not might get the outcome that they're looking for. That's a big thing. Well, I spent 10 grand. I don't give a shit if you spend 100. He still may not live. You know what I mean? But don't be an
Mhm.
asshole. Be supportive. Be there for your client. Be their advocate. Go to your doctors and be like, you know what? They can't afford this $5,500 estimate. This is what they have to work with. Can you come up with something else? And doctors Don't be assholes. Just because your client cannot afford that gold standard plan that you just put together, have a heart to say,
You couldn't
okay,
8 years ago when you were going into vet school, you couldn't afford that.
exactly, exactly. Have a heart and say, you know what? I understand you can't afford gold standard. We can try this against medical advice. I'm willing to do this, but you got to sign an AMA that I gave you all of your options and this is what you chose to do
Yep.
and proceed that way. You know what I mean?
Yep.
Owners, if you're
Yeah.
listening to this, don't be assholes. Don't treat us like we're there for the almighty dollar because emergency care is expensive. For us to operate those facilities, to pay our staff, to have the medications that we do that are readily available for your pets, to have the treatment options, the diagnostic options, things like that available, that costs money. And in the veterinary world, yes, we're talking about insurance, but insurance doesn't work the same. Insurance doesn't pay the bills in our
It
world.
doesn't.
On the human side, it does.
No.
Our side, it doesn't. We don't have insurance to fall back on. We're not, if you come in there and you don't pay your bill, we have no way to collect. 9 times out of 10, we don't even send you to collections because we don't have the money to be able to do that. You know what I mean? We don't have the funds to be able to send things to collections or the funds to put into the labor for people to reconcile those bills and get them out to a collection company. Anywho,
I was gonna say, I was like, people, I want to give this example to the non-veterinary people that watch this, right? So they're like, well, why can't you just do a payment plan? I worked at a clinic where this woman, and it was the one before that I worked at, not the place that, it was the one before that. Out of the goodness of the heart, the emergency clinic that she worked at, she literally gave so much away for free, right? So people came in and said, I can't afford this. She would put him on a payment plan. And in 1 year, she had over $300,000 worth of money that was not being paid off of a payment plan. So I just want you guys to think about that. You may be the 1% that pays,
yep,
right, on your payment plan. It is $75 a month, $150 a month. Cool. Over 300 grand that was not paid in 1 year. And just from December to December. He has to, then that's, and I can tell you that it wasn't, she wasn't fluffing the bill, right? It was straight cost that came out of physically her pocket out of the clinic, right? That is not chump change. So when you say, "Oh, why can't you guys are just in it for the money and in it, why can't you just do a payment plan?" We can't do that either. We're not in it for the money. We don't make what hospitals make. We don't charge what hospitals charge because we wouldn't see you guys,
nope,
right? We charge $50 for a bag of fluids. They charge 500 for a bag of fluids. Comparison, right? Same bag of fluids, 50 versus 500.
literally the same bag
Their
of
overhead
fluids.
cost, literally the same bag of fluids. Their overhead cost is different than ours. That's why there's such a gap. And that's out there on the World Wide Web. You can look at the cost difference, right?
Not the World Wide Web.
The World Wide Web busted out my old schoolness. But like, you can't fathom being in the hole on a payment plan that people said that they would pay 300 grand. But I think it was closer to like 350 or something like that. But like, she still had doctors getting paid, technicians getting paid, overhead getting paid, right? So she had all of those things to still do with people saying they were going to pay. She didn't
Product
charge
that got
interest. I
used
can
and
tell
went
you
out the
right now,
door.
she did not charge interest. Like she literally just bled for people and their pets. She was literally out there to help people, and she was a little rough around the edges, right? She has some quirks, but
The best ones always do.
I just wanted to put that in the grand scheme of things too. You're saying you're gonna pay. We don't see it. We've literally had so many chances to people, and they didn't pay, including rescues that said that they would pay for their pets coming in to be seen, also racking up a bill
Hmm.
and not paying for it. And that's, a whole nother slew of things. But I just wanted to put that out there when they say, well, they can just do payment plans. Why can't they just work with us? It's proof that you guys don't pay. And I say you guys because I came from that side. If I was put on a payment plan, I would actually pay, right? Because like, I've seen it where it doesn't happen. And I want to be able to still take my pet there. And you can still take your pet there because you're proving that you are paying a bill,
Yep.
right? You're paying your balance off. But it just doesn't happen.
No, there are very few unicorns, I would say, in that situation that actually follow through and pay their bill. And it may take them
Unless
years
you're a
to pay it
stripper.
off. I'm thinking about
And
it.
like I was gonna say, unless you're a stripper, because if a stripper came in and they said, I'll have the money to you by 8 a.m. in the morning, I would believe you.
Yep.
Because that's happened a time or two.
Yep. Like how much is it? okay, well, here's 500 and give me a couple hours, I'll be back. And I'm like, where do you work? Because I
You
get
know,
off in about an hour.
and you guys don't, but like, honestly, it is 2 o'clock in the morning and they came home from their shift and their cat is blocked, and we give them that bill on getting it unblocked to take to their RDVM, and they have a balance of 800, and they're like, okay, I'll be back at, you close at 8 a.m. I need to get my cat by 8 a.m. I go, yes, ma'am. I was like, ideally a little earlier because
Mhm.
that's, we would also like to go home. And she was like, I'll have your money. And I hesitated once and I never hesitated again when it was a stripper
Nope.
because y'all always pay your bills.
Always. Always. Come with a fat
Always.
stack of cash looking like an overworked football player, sweaty, like your upper body's probably in pain. But damn it, you're paying your pet's bill. You're paying your pet's bill. And you brought us donuts. Stop.
And you had enough to get us a snack on the
Stop.
drive home. That was the only time
I just,
I ever would be like vouch for an owner that said that they were
yeah.
going to come back with the money.
Yep.
That was the only time.
I
It
just
was when the strippers came a knocking.
I just wanted to go up and down 19 with visit vouchers. You guys are awesome. Come see us anytime. You know what I mean? I just wanted to just take it. But
And like we worked in an area where there were strip clubs, and I never had to. I hesitated the first time, and the only time I ever hesitated, and it was the coworkers. They're like, "Nope, we'll see you. We'll see if you can be here by 7:45. That would be great. Enough time to go over the discharge instructions and us to lock the doors behind you." They were here at 7:45
yep,
with a wad of cash,
water
and it
cash,
was enough.
Starbucks in hand, ready to go. Okay, tell me what I need to
Yeah,
know. I got you. But yeah,
yeah. That
just
was the only. Yeah,
yeah.
I had to throw in the strippers on this one
Why not?
because you know what? Get it.
Get
If I
it.
could, I would.
Oh, me too.
Come little ballerina, nighttime ballerina.
Hell yeah, 'cause then
Any
I can
perks.
fish during the day. Anyway,
Hmm.
you know how much fishing equipment I could buy? Well, I wouldn't be a good stripper. I probably wouldn't make a lot of money. But anyway, I guess there's somebody for everybody, but not for me. You know, I'll go towards fishing equipment. I'd have a boat by the end of the month. You know what I mean? I could be a professional cuddler. That's probably the only way I'd make money because you can't see me.
I'll be the bartender because I need the corset to help keep everything like snatched and up.
Snatched and
But I'll pay
up.
the money. I'll do it.
Snatched and up. What the
Hmm.
fuck?
I can't go to a naked strip club where you have to show all the good goods without any kind of support. Big titty committee can't do that.
And people will pay extra for that, Joyce.
They don't. They want the skinny little things that bounce.
No, they don't. No, I
You
promise
know what?
you.
You have not seen the TikTok videos that I have.
Okay.
I'm gonna send some to you.
We'll have another what the vet, but not the vet episode. We're going to talk about strippers. Okay.
Yeah. So if you guys have any insight in this and want to throw in your 2 cents, drop a comment. This is our experience that we've faced with all of this. And I mean, we're not just talking about it. We lived it. I lived it. She still lives it. Uh, of not being judgy bokus.
Yeah. Yeah. Don't just drop a
We're not in
comment.
their shoes.
Stick with the
Yeah,
theme.
at least at least like the video if you watched it. You don't have, share it, spread the word, spread the love. We want to keep going on this. We kind of have fun yelling at each other and ranting about things. It gets stuff off our chest
It does, but
after 16 years into it.
don't just do those things. Don't just drop a comment. You got to stick with the theme of the end of the conversation. Make them bitches rain. You got to make it rain. Just comments, like, shares, all of it. Hook us up. Get us out there.
Make it
Come
right.
talk to right. Come talk to us. Come bullshit with us. Come complain with us. We need more input, guys.
We like conversations.
We do. And people that can talk shit
We
and
do.
not get offended. Like Joyce. Fucking baby.
I'm a sensitive creature. I can't help it. I'm a sensitive soul. I'm a
Mm-mm.
Cancer. I'm a Cancer. We're
You are
ruled
not
by the moon. We're
sensitive.
very sensitive.
You're not sensitive. You're not sensitive.
Some people, some people say I am.
No, you're not. Because if you ever went to prison, you run that shit by the end of the week. You are not sensitive.
I would drop a bitch. I'd probably cry about it, but I'd be like,
Be crying in the shower. I can't deal with you. You guys have an awesome rest of your day.
I mean, I kind of can rock orange color, so
Your eyeshadow went mad.
you know what I would do? You know what I would totally do? Get a guard to fall in love with me.
You know, you would probably, by the
Done.
time you walked in the door, done, done. You'd have whatever you
Done.
wanted.
Got
You'd
my
have
end.
you'd have all kind of contraband makeup and all kind of shit by the end of the night.
I would. I would.
We need
All right,
therapy.
guys. Until next week.
Have a
Bye.